I'm Judy Belle Brown, and I'm a professor here, the Department of Family Medicine. I'm currently the interim director of the Center for Studies in Family Medicine, which is the research arm of the department. The research arm of the department is staffed by faculty who are interdisciplinary. We have epidemiology, social work, family medicine, psychology, and health services research. And we also have a very excellent support staff who really help the center run and be efficient and help the center run not just for the center's sake, but also for the Department of Family Medicine, and offer services to clinicians in the community as well as the Department of Family Medicine. The center has been very prolific in terms of its publications and the number of grants that we've acquired, and certainly in terms of dissemination, whether that be publications, seminars, conferences that disseminate and transfer knowledge of the work that we've done here. An example is certainly the work that we've done in the electronic medical record, and how we have, from that program, which is called Delphi, is actually a researchable database with family physicians using an EMR, and has gained definitely national recognition as a model for using the EMR as a research component. And I think that has really helped us spin off a number of other programs and programs of research specifically, and then some knowledge translation as well. I think another really leading area that we have here at the center is that we are in collaboration with several universities across the country with a program which is called Tutor PHC, which is a CHR strategic training grant for training professionals in interdisciplinary primary healthcare research. And clearly we have gained a national and an international reputation with that program, because we also have fellows who are funded through CIHR from other across the country, but also we have people who are coming funded by their own countries from New Zealand and also from the UK. And that program has been renewed for another 7 years, and we're now into that second cycle, and we're just very excited. We've now graduated approximately 100 fellows. So in terms of building the infrastructure of family medicine research in the country, we've made a definite contribution in that area. Family medicine research is still relatively novel, not novel, but still in its, shall we say, its adolescence in terms of people being skilled to do primary health care research, and therefore the tutor program has really been critical from that standpoint. Another important area of research that our center is participating in and is led by Dr. Stuart Harris is his program of research on diabetes. And certainly this has been a tremendously important and leading cutting-edge work that he has been doing. And it's also important from the standpoint of more research that we're doing looking at chronic disease and multimorbidity. This is, with our aging population, certainly an area that requires further research and more intense research, because many of these conditions are cared for by family physicians at the coalface, and we really need to be preparing people in a way that they can meet the challenges that are inherent with this population and to provide appropriate, timely, comprehensive care that is also patient-centered. Patient-centered care has been a real flagship program for the Center for Studies in Family Medicine, and was really very much the brainchild of many of the significant contributors to the center. We've had research in this area. We've also been able to create an international series of books, with the anchor book being the Patient-Centered Clinical Method textbook, as well as a case book recently published on narratives. And we also have 8 other books in the series which cover a variety of topics such as addictions, chronic disease again, palliative care, medication prescribing. So this has been I think an important contribution of the center. And again, these books we have been the book series editors for the for the international book series. What's important is that these books have been written by international authors in family medicine. So we see family medicine growing as a discipline that has a very strong academic core, and certainly the publication and dissemination of such information as is found in the books, as well as the research knowledge translation, really strengthens the evidence-based nature of family medicine. The Center for Studies has always had extremely strong leadership, starting with Dr. Martin Bass, followed by Dr. Moira Stewart, who just finished her term in the last 6 months. I'm currently the interim director of the center and will be in this position until we are joined by Dr. Merrick Schwarnstein in April 2013, which will actually coincide with our move to our new building. So the future is very exciting for us, holds a lot of promise, a lot of change and growth, and we're really looking forward to it.